Hello everyone, I'm Dr. Nazim, consultant orthopedic surgeon at Medistar Hospital, Ameerpet. So today we are going to discuss an extremely common presentation which is called as ganglion cyst. What is ganglion cyst? Ganglion cyst is a lump-like swelling which we see on the wrist. It can be seen on the dorsal side of the wrist or can be seen on the ventral side of the wrist. Since it is a very common presentation, so many patients have questioned whether is this related to any cancer or is it malignant or is there any problem. Okay, so to be very clear, this is not a malignant swelling. This is not related to cancer. It is a completely benign lesion and most of the times it is asymptomatic. The most common complaints patient come with is the cosmetic appearance of it. Most common the most common presentation is on the wrist. Most of the times the wrist is exposed. So anytime the lump looks ugly, looks unsightful. So that is the most common complaint. Some of the patients, they might have a complaint of pain while doing a lot of work, while doing more wrist movement. Okay, so other than wrist, it can also be seen at other places where, such as foot, such as ankle. So wherever you have the synovial joints or the synovium, the tendon lining, so at such places you can see this presentation. So other thing is some patients might feel pain, and in some very rare cases it can get infected. So what is the management? So most of the time the management is only observation, and indications for surgery are the cosmetic appearance. Most common indication is when the patient is like they don't want to be look. So that is the most common indication for surgery. Other indications are if it is infected or if it is causing pain, it is causing compression symptoms. When it is compressing the structures beside it or adjacent it, such as nerves or vessels, and the compression is causing symptoms, that is an indication for intervention. So what do we do? So depends. Initially we can go for aspiration, but the recurrence is high with aspiration. Even after the aspiration, the swelling is recurring. Then we go for surgical excision, and the recurrence rate with surgical excision is very less. Thank you.
మీకు మంచి ఆరోగ్యం కోసం ఎల్లప్పుడూ తోడుగా మెడిస్టార్ హాస్పిటల్స్.